TV.
Welcome back and many thanks for staying with us right here on Morning at NTV. You're going to be talking about a contentious issue, the plight of young women during the COVID-19 pandemic. Not only young women, women in general, young and old. How have they been grappling during the COVID-19 pandemic? What are the challenges and how best can we draft some recommendations to alleviate their problems? Women have been suffering a lot, and gender inequalities have actually widened during the lockdown. We've seen so many social norms take center stage. A woman is supposed to be doing the cleaning and so forth. All that, the social norms that have taken center stage during the COVID-19 pandemic have exacerbated the gender equality gap in Uganda. Well, you have an organization like MEMPRO, which was instituted in 2008 to fight such inequalities, but they are saying during the pandemic that gap was folding, diminishing since 2008. So during the pandemic, it diminished. You saw so many women being battered, domestic violence, young women getting pregnant and so forth, poverty. And we are going to expound all that with the executive director of the Mentoring and Empowering Program for Women, that is MEMPRO. And she joins me right now. That's none other than Immaculate Mukasa. A very good morning. All right, let's get right into it. The challenges women have had to grapple with during this COVID-19 pandemic. Let's first get that out of the way, and you'll let us know what MEMPRO is, Mentoring and Empowering Program for Young Women. What you've been doing since 2008, how are we doing better? What got worse during the COVID-19 pandemic, and how can we rectify that? It's a holistic approach that we're going to be discussing. Let's kick off.
Let me start with what MEMPRO is. MEMPRO is the Mentoring and Empowerment Program for Young Women. It was established in 2008, and we will desire a society where girls can achieve their aspirations, and also where they live in an environment which is free of violence. And together with the government of Uganda and other civil society organizations and NGOs, many steps have been taken to see that the girl child is empowered, that the girl child achieve her aspirations, although we've had a few challenges. But with the COVID-19 pandemic, we are seeing that many of the gains are going to be lost because of the pandemic.
Would you say there has been an uptick in violence against women during this period of the pandemic?
Definitely.
And what has been causing it?
Very many factors. Number one, the strain on the resources at household level. We expect to feed the family, the children who are at home. We expect resources from the man, from the woman, but those resources are not there. So the demands of the households have caused violence. The men have become violent. There is money that is left, usually called akameza money. It's reducing. So because there's not enough, and the demands are too much, the children have to eat. You can't tell them there's no money, they have to eat. If you need to access health services, you have to access them. So,
and all this is leading to domestic violence.
And all this is leading to domestic violence because tempers flare, and what happens next is domestic violence. And there has also been a challenge in that because there is no transport, reporting is also difficult. So women have been suffering differently, and the men also, although the magnitude of the suffering of the women, violence against women is quite high. They can't escape because they have not been means. Now that the lockdown has been lightened a bit, but the effects are still felt.
And we're also hearing that some of them are scared to say anything because they are depending on these people who are actually taking advantage of them.
That is very true. And also, there's also our culture of normalization of violence and protecting the family name. So the women suffer and they die silently.
How did the social norms contribute to this violence?
So in the social norms, like I'll talk about some of the cultures, the practice is that some of the women actually believe that if he beats me, he loves me.
Wait, what?
So if he beats me, he loves me. If he does not beat you, he doesn't love you.
That mentality is still prevalent?
That mentality is still there. Yeah, you ask women, even university girls, they have that mentality. They come with it from their homes. So this is a challenge we have at hand. And also in other cultures, it's like if he beats you, the first person you report to is his brother or his mother or your auntie, and all of them who are socialized in keeping the home. keeping the name of the household. So the women will keep quiet instead of reporting because of those social expectations.
And the family mediations, do you think they have played a role to exacerbate the violence against women? When there is a case and family chooses, no, for us, we are not going to police, we are just going to settle this as a family.
What has been happening is that most of those, violence is a cycle. Most of those cases that they are not effectively dealt with, the perpetrator is not dealt with. So this woman goes back because the idea is that you keep your marriage. You have to stay in there. Whether you are dying, you have to stay in there. How does society hear that you left? And also, bride price. Although there was a law that passed that it shouldn't be accounted to as because you paid bride price, then you have to suffer, or else the bride price is taken back. That was outlawed. But many of the cultural practices are that once bride price is paid, you are paid off. You are gone, no matter what happens. Yeah.
So when you look at this situation, do you contend that maybe it could get worse if this lockdown persists?
Oh, if the lockdown persists, it will get worse and worse.
How so?
Number one is that because you can't even go to that person or that relative to report. Number two, you can't go to police because there are no means of going to the police. In some cases, many CSOs and the government of Uganda have provided numbers people call in order to be rescued, but it is not practical. Most of our time, they beat you, you don't have airtime. They beat you, your phone is already spoiled. So it is very difficult, it's challenging to have justice accessed in this country.
Let's discuss the gender roles. Yes, we talked about cultural norms. Let's talk about gender roles that have been assigned to each one of us. You have society that says a man is supposed to be going out there to look for food, but a woman, caretaking work, unpaid work and so forth. You have to take care of the family members, and that also, opens them to the risk of getting or contracting the coronavirus. So let's talk about how these gender roles have made life difficult for women.
Let me start from the working women, formal working women. So these working women have had to spend a lot of time at home, but also some of them working, and their resources were depleted because you are a mother. You are expected to feed the family. If the man says that there is no money, you provide the food. So most of their resources have dwindled. Yet, on top of that, their expectations at home remain. The women have to, you wake up, you cook, you bathe the children. All that takes time. You clean the compound, making sure that the house is in order, so to speak, and there is food. All that takes time, and on top of that, you also have to work. It has an effect on your health as a woman, and nobody will see that. And in this, when we had the lockdown, you could not even access a hospital. It was difficult to access a hospital. The informal sector women, let me talk about the market women. They've had, some of them they had to sleep in the market. That's also risking their lives, risking their health, but also exposing the family they left behind. We had a case of one of the CSOs whose child was molested by a boda guy because this lady works in the market. She had to keep sending the boda guy to take stuff at home. So the guy used that advantage. So it has been a mix of challenges, and the COVID-19 just made things worse.
And would you say government has put in place enough measures to mitigate these problems and give some kind of reprieve to the women? Do you think the whole COVID-19 response, the National COVID-19 Task Force, put in place enough measures that were answerable to the needs of women during this lockdown?
There is lack.
How so?
So let me give an example. Response has been slowly by slowly.
Yes.
So at first, even the national call centers to respond to child abuse, Sauti, was closed. There was no consideration for women who suffer domestic violence. You remember when the RD, when you have to get permission from the RDC, it was about corona and very, very sick patients. And the women, sometimes they can't wait. If you are pregnant, you can't wait. And if you need to access health services, your child is sick. It's difficult to have to first line up and then go to the go get the letter and then take the child. Many have there are also a substantial number of children who have chronic diseases that need immediate response. So with time, the lockdown has been eased, but still it's not easy. I would say, like, let me give the example of the use of public transport. Still, it is still at 43%, even with the open up of the lockdown. What that means is that, yes, it is there, it is eased, but it's expensive. A woman cannot afford. A woman from the informal sector cannot afford that double, the transport. Number two, also the provision of masks. How far have we gone? Only a few districts have received, and if you know that I can't travel with a mask, that's also an impediment. And the services themselves, how open are they? We are open, yes, to travel. It is expensive, but where am I going? Where I'm going to receive the service? Will I find the service itself? We find that even the police stations, if you are to report a case, sometimes the officers are not there because they are deployed elsewhere. Yeah.
Now, with the resumption of transportation within Uganda, do you still register any cases of poor access to health facilities, poor access to sexual, reproductive and maternal health services? Do you still get those cases?
Yes, they are there. Even before that, they were there. Number one, if you got the system themselves.
Yes, before that it was worse. But then with the resumption, we thought that maybe, okay, people will have to be in a position to move. So? How different?
Like I talked about, first of all, to get to the center is a challenge.
All right.
That it is very expensive. Number two, most of the resources in the big hospitals have been diverted to fighting COVID, and also some of the personnel, you find that they are not there. Number two, there is also a challenge of we have a problem of child mothers. We've had a lot of pregnancies have happened.
Yes.
But the question is, do those girls access antenatal care?
Good question.
How are they treated when they get there? Are they put in a pool like all adult women? So there is that specialized care that we need for children who are pregnant, which is not necessarily available because of lack of resources, but also because of the systems in which we work. Number two, if you see that there are many cases, many girls who have gotten pregnant, how many have had sex without getting pregnant? How are we allowing those girls to access sexual reproductive health information and services? So by the fact that they are having sex, or by the fact that these are pregnant, that means you have a gap in access to sexual reproductive health rights and services. Number two, not all women have a say in their own sexual reproductive health as women. Most of them, we find that they have to consult their husbands to ask to get family planning. So it is a big systemic and cultural challenge.
Wow, that is really, really mind-boggling, Immaculate Mukasa. But then let's talk about the mentoring and empowering program for women. What are you doing as an NGO to ensure that you alleviate this plight the women that are grappling with?
When we meet a woman, our target is women and girls, and mostly girls and young women. So when we meet that girl, there are things we have to talk to them about. Number one, you need to value yourself. You as you have to know, this is who I am and this is what I desire in life. What are your aspirations? And we start from there. We usually find that the moment the girl values her life, she has a say, she has a voice, she has a say in her life, she has a say in what she wants to achieve. That means she'll be a leader. That means she'll have a say in her body. She'll have a say on the choice of partner she has. She'll have a say on when to have sex and how to have it, on the number of children she desires. Most times that happens. And she can report in case her rights are abused.
Well, of course, the COVID-19 pandemic has wrought economic challenges on the entire globe. In the United States, they're now talking about 50 million people out of a job. In Uganda, what are the numbers? Are we looking at 40 million, and the women particularly? What is the number? People losing jobs?
Generally, on the papers that monitor, according to the monitor papers last month, they were talking about 40 million jobs. But here is the trick. In Uganda, we borrow trillions of money
Yes.
for economic enhancement. And they are talking about small-scale and medium-scale farmers. But they want registered or small-scale and medium-time enterprises, but they are talking about registered enterprises. In Uganda, 71% of women are in the informal sector. Those are the roadside vendors, the women in the markets, the women on the farm, the women doing their own small merchandise or trying to sell things here and there to make a profit. So all those ones are out of the number of people who are going to benefit from that. But when we are paying back that money, there is likely to be inflation. And the cost of the goods and services, that cost will be felt by this woman in the informal sector. That means that it will be costly. They will remove most of their profits in order to afford the basic needs. So it's not fair for the
So
for
with
the
all these dire economic constraints that women are facing at this time, does that mean that we might see a low representation of women during this election period? Few women engaging in politics because of dire economic constraints? And what impact would that have on representation of women?
When the woman is constrained,
Yes.
her first priority is her family. She needs to be given, if we want women in leadership, they need time, they need capacity. And our desire is to have as many women as possible being represented.
Would you say we are going to be seeing few women as a result of these constraints?
At the lower level, it's likely to be. At the lower level, it is really likely to be because the families are shattered.
Okay, let's talk about what government should do ideally as we wrap up. What recommendations do you have for government moving forward to alleviate the plight of young women?
For the government, we need to strengthen the justice system. We need to see fairness in dealing with cases of violence. And that's the only way where that violence will stop, reduce or stop. If the government is not responding, if the systems are poor, the perpetrators will keep going away just like that. And also we need economic policies that are sensitive to the majority. And the majority are the women in the farms, and the majority are women who are producing our food. We need to support women who are producing food. We need to subsidize the inputs for the women. We need to ensure that the women are supported along the food chain, are supported. Value addition is important, and all those things. In education, we have to put a gender lens there because we need many women as possible educated. We also need many women in leadership because once they are in leadership, they understand, and they will advocate for the needs.
And of course, according to a study I was reading yesterday, you mentioned a very, very good issue. They were saying it's now more than ever that men should be leading more like women. Remember, out of the 195 countries in the world, 19 only are being run by women. Yes. And now they were saying the women have been so instrumental in combating the coronavirus. Like in New Zealand, the case of the female president, she actually did so much Jacinda Ardern to ensure that the coronavirus did not spread so much. And now they are saying women should not lean into men, but men should actually lead more like women in that case. So we need more women in leadership because you talk about the issues that affect everyone not in a selfish way. Yes,
because we are mothers, we know what is happening. And also the government needs to recognize that the women also come in very many packages. There are women who are in the farm work sector, but the majority are in the informal sector.
So help us understand, how best can we bridge that inequality gap?
It's to come back to the women, listen to the women, listen to the voices of the women.
All right. Immaculate Mukasa is the Executive Director of the Mentoring and Empowering Program for Women. And we've been talking about the plight of women that they've had to endure during the coronavirus pandemic, ranging from so many things, the economic and the political aspects of the same. Does it mean that if people do not have, women do not have enough money during the pandemic, does that mean that less women will be participating in the election? And what effect would that have on their representation come 2021? And according to that study, yes, women shouldn't lean into men. No. But men should actually lead more like the women right there. So there you have it. Let's take a short break. We'll be right back with more information right here on Morning at NTV.